right. Hello, everybody. Welcome to the Girl Talk. I'm going to give you just a few more seconds to let everybody get logged in here, and hopefully we'll get all this rolling. So thanks for joining me tonight. Tonight we get to talk about all the important girl things. So what I'm going to do is share my screen with you guys. I have a little presentation that I want to share with you all, so bear with me. I'm not always the greatest with all of this, but like I said, welcome to Girl Talk. So tonight we're going to talk about all of the different services that we offer here at Genesis, from anything from from bioidentical hormones all the way to vaginal rejuvenation using different types of treatments, and then to the O shot as well. So we'll dive kind of into this. First I'd like to just start off by saying we are supervised by Dr. Ferris. He does a wonderful job of keeping us up to date on all of the latest and the greatest information out there. He has lots of years of experience in all of things women. So you are in great hands with Dr. Ferris and of course with all of the staff here at Genesis. So let's kind of jump into what things look like for women. A lot of women struggle with so many different things, and it can be related to several different things. So if you are someone who is struggling with just kind of not feeling yourself, you feel like over time things have changed and you don't feel like you have the energy, you're not sleeping well, you have no sex drive. Some women avoid sex because it's really painful because they have so much vaginal dryness. There's so many different options that just you don't have to live like that. So the first one here we're going to talk about is our hormone replacement clinic. This is sponsored by, or we use the company that's called BioT. They are strictly a bioidentical hormone-based pellet that we insert into your hiney. So the benefits of being on pellet therapy really just revive back your youth. Our body over time really just starts depleting from testosterone and estrogen. And once all of that starts to happen, then you start to be tired and sluggish. You start to not sleep well. You have hot flashes and night sweats. You have zero libido. You can get that brain fog or memory loss, just fuzziness, kind of like feeling you can't kind of finish a task without forgetting what you were doing. But all of this is just a natural sign of aging. As we age, our body naturally stops producing testosterone and estrogen. And a lot of women will think, well, I'm a woman, I don't need testosterone. Well, testosterone is just as important in women as what it is in men. We, however, just don't get the amount that a man would get. But testosterone does so many important things, from our energy to helping us to sleep better. It helps increase that libido. It will help us to build strong bones. It helps to protect our heart and protect our brain. Women are at a really, really high risk of cardiovascular disease. So it's really important to do things that help protect us and keep our heart as healthy as what we can be. And estrogen plays a really important role too. Some women will backtrack. It's natural just that, over time, once we hit menopause, our body will stop producing estrogen and it feels like everything kind of just dries up. Those ovaries stop doing what they're doing. Or sometimes women get thrown into it by having a hysterectomy, and then that just puts the process into overdrive. So estrogen is really important for our bodies and, helping with our mood and our skin and our hair. It can help with burning belly fat. It can help protect our heart. So it plays so many different important things that we can be missing. And so by this process, or this bioidenticals, we are going to replace back into your body what you have lost over time. Sometimes women will get a little nervous that we are putting hormones back into the body because there's been a lot of different cancer scares. This really doesn't have those high risk of cancers because we are giving you bioidentical. So this is something naturally occurring in our bodies, and our bodies recognize this testosterone or estrogen as it's floating around in our bloodstream. So they know exactly what to do with it. And there's none of that harmful man-made chemicals that can be put in there. And really, when we look back at a long time ago, when women were getting breast cancer from estrogen replacement, it was more of those synthetic versions of of the hormone that was causing those problems. So with this, it's benefiting you. There's nothing bad in them. For us women, we will be coming back every 3 months to have this done. So it is a kind of a progression of it starts to kind of kick in, and over a couple of weeks you'll start to notice, I'm sleeping a little bit better, I'm feeling a little bit better, I have a little bit more energy. And then that's when maybe the libido will start to kick in, and then over time you will just start to feel better and better. We do have you come back at 6 weeks so that we can check in on you and see how you're doing. We draw some more lab work to see where those levels are, and then once you're there, we just kind of keep you on a nice natural regimen of every 12 weeks or so for most women. As far as kind of the after effects or like the downtime, you're going to have a little bit of a sore hiney for a couple of days, but really nothing that's too life-changing or will inhibit your normal, unless you're like a heavy runner or somebody who does heavy squats and lunges. We have you stop doing that for a couple of days as well. But then after that, you're just kind of grooving along with your life, feeling better, feeling more refreshed. One of my favorite things about being in this clinic and seeing you guys come in here, or I should say you ladies come in here, is to see where you start at your consult, and it's affecting life. It's affecting your marriage. It's affecting your workplace, maybe just different relationships with different people. And to see the change that you make over the next 6 weeks or the next 3 months is so gratifying, and it honestly just warms my heart to see those changes. And honestly, probably the biggest one is, we have to face it, is it's sex. Women really probably put it on the back burner and they just are too busy, they have other things going, but it does affect our relationships, and it's an important piece to our relationship. And when that's going great, it just really makes all of our life better. It makes our relationships better. And one of the other things that I really like is that once the wife comes in and starts the treatment process, a lot of times her husband will soon follow suit with her, just because he sees how great she's feeling and how she's doing. So he thinks maybe he wants a little piece of that as well. So like I said, this is just an all around great treatment process, helping you on that day-to-day basis, getting you to feel better and giving you just all those tidbits of life that we've kind of been missing. But then on the backside, it really, really is just being really health protective for you. And it's giving you that heart and brain and bone protection that we all really need. So I encourage you all, if you're interested, to come in. From being on this webinar tonight, you do get a free consultation with Dr. Ferris. So we spend about an hour here in the office with you, and we thoroughly go over all of your symptoms. We learn about you, and then we just educate you even more on what we can do for you and how we can help. We also draw blood at that appointment and get some lab work back that we can see kind of what's going on. This lab panel is a really comprehensive panel that looks at a lot of different things. It looks at your female hormones to see how those are obviously doing, but we're also going to look at your thyroid. Your thyroid is a really important part of your body as well. It's a regulatory gland. It controls your metabolism. It controls your body's temperature. It can help in how you sleep. A lot of people will come in a lot of times and they're like, I've been to my doctor and they say my thyroid is fine. And there's really a key important part of the thyroid that sometimes gets missed in lab work. And so we really focus on that T3 number. It's kind of, for long story short, it's the end result of what our thyroid does. And so sometimes that gets overlooked in some of the physician offices. And so that number is really important to us. So if you've been somebody who has been told, no, your thyroid is fine, everything looks good, maybe that should be a good, you should come in and see us, because I think that we should take a look at it again and see if it truly is fine, or if maybe they weren't quite looking at the right number, because the thyroid makes a huge, huge change in your life as well. And then the other piece that we're going to look at is all the different vitamins. We're going to look at your vitamin D and see what that's doing, especially in this crazy COVID world. It's really important to have high levels of vitamin D. Vitamin D is really important in our immunity. It helps to, ward off all of those yucky bacteria and viruses. So that's just another thing that we can do to help keep our bodies healthy. And then along with that, we're looking at, a full blood panel a full blood count, looking at your electrolytes. And so we're really getting a full comprehensive view of you and what you have going on. So I encourage you to make an appointment. I promise you will never regret it. It is truly life-changing for a lot of women. So the other things, I didn't kind of touch on is the weight part of BioT or being on hormone replacement. When people come in and they, their main concern is that I just can't lose any weight. I've tried everything and I'm just stuck. And that can be contributed to your hormones a lot of the time. Our hormones can cause our body to hold on to everything and just not allow us to really properly burn that fat like we should. So BioT or bioidentical hormones over time will help you with that healthy lifestyle, healthy living, and then helping to eventually start to really build lean muscle mass and then to decrease that fat mass. I always tell all of my ladies when they come in for a consult, though, that this is something that doesn't happen overnight. This is something that's going to happen 12 to 18 months down the road. So it is really, truly a commitment of staying on this and working through the process and getting your body nice and acclimated and getting the hormones saturated in our body, because for so long they probably were so dry and so depleted of hormones that it takes our body time to adjust to it. So same story goes with building lean muscle and burning that fat mass. Over time you are going to see that benefit come to you, with the help of bioidentical hormones or those pellets. So not only is it going to help to build that muscle, but you're going to have more energy. Maybe you're going to want to work out a little bit harder, a little bit stronger. I can tell you my personal story. I'm, in my 30s, I've had 3 kids, and I like pellet therapy. I would not do without it. I don't get estradiol, obviously, because I'm still a cycling female, but the testosterone plays a really important part in my life. I love that it gives me more energy. I have a child who does not sleep, so I'm hoping that it helps a little bit with that when I do get to sleep. And then the biggest thing that I notice with it is that it really has built my lean muscle. I can really see my body taking shape, and I like that. Obviously, it's not like big, bulky muscle. I'm not looking like a bodybuilder or anything, but it just helps to give me that nice definition. And of course, the libido is always an added bonus to that as well. Just with life and kids and just life, I think as women, we just kind of put that on the back burner. So that has kind of brought things back and made things a little bit better as well. So that's kind of my spiel on BioT. I hope, like I said, you guys who are listening, I hope that I have answered all of your questions and encourage you to come in and see us for a consult. So with that said, then let's move on to the vaginal rejuvenation part of it. Pellet therapy is a great start, but it doesn't mean that that's where you have to start at with vaginal rejuvenation. If you are somebody who has any of the concerns, vaginal laxity, a decrease in your lubrication, pain during intercourse, you're wanting more sensation, or you're wanting more tightening, or you have stress urinary incontinence, these 2 treatments are a great option for you. We here at Genesis are really lucky that we have 2 different types of machines. So I always tell people, don't kind of get tripped up on the different types of machines that we're talking about, because at the end of the day, they do have the same results. We just are fortunate to have kind of 2 roads to get to the same destination. So the FemiLift is one of them that we have here. It is a laser treatment that we use. It does require a little bit of downtime. That machine, I like to use it for more when women really struggle with dryness. I feel like that does a better job with it. And then the Vitalia is a radio frequency based treatment that does all of the things that I just talked about: vaginal laxity, lubrication, increases your sensation. And it will also help with stress urinary incontinence, as well as that internal and external tightening. So kind of backtracking just a little bit, our hormones obviously play a huge factor in kind of our lady land and what's happening down there. It's normal aging process for our vaginal wall to become thinner and tighter, and tighter not in a good way. You know, if you are somebody who is struggling with pain during intercourse, some women can have bleeding after intercourse. That means that your tissues are really thin, and that friction of during intercourse can make things really uncomfortable and can agitate and irritate and get that pain as well. And with the vaginal wall not being as thick as what we would like it, that also means we have a decrease in blood flow. We have a decrease in lubrication. So not only are you not going to have the pleasurable sensation that you're hoping for, you're going to have dryness, and you're going to have to use additional lubrication or outsource of lubrication. So looking into these treatments are really great ways to do that. And then the other nice thing that it does is if you are somebody who can't jump or can't cough or laugh or sneeze without peeing in your pants a little bit, then this is also a great treatment for you. Our bladder sits kind of on top of a muscle. And so over time, this muscle can become really weak, and it doesn't give that control that we need. So the Vitalia, and in a later slide here, I will show you what the probe looks like so that you can kind of understand that. We'll talk a little bit more about the treatment itself, but that once that probe is in there, what it's going to do is it's going to emit that energy, and that's going to stimulate our body to start that rejuvenation process. So over the course of time, then you are going to thicken that vaginal wall. And then with the thickened vaginal wall, you're going to increase the blood flow to the area. Increased blood flow means increase in lubrication and increase in sensation. And then, with age and weight and pregnancies, we can have vaginal laxity, whether it's internal vaginal laxity or on the outside on our labia. This machine can also work for treating that. The radio frequency waves are emitted and help stimulate our body's collagen, then to help get that tightness back. So and then FemiLift is going to do really the same things. Like I said, I just feel like it does a little bit better with women who struggle with dryness, but I get phenomenal results with the Vitalia for ladies who have dryness as well. So we are just fortunate enough to have two different types of treatment. So then we'll kind of go to, this one talks about the Vitalia. You can see here, this is the probe. Some women are always a little nervous about what is it, what size is it? And so you can see it's a small little probe. It's actually probably about the size of my finger. It's a very comfortable treatment for you. It is done in a room with one of the nurses, and it's basically warming those tissues back and forth. And our goal is to keep your temperatures at keep your tissues at a set temperature for a certain length of time. And so we just kind of move through there. Sometimes you don't feel anything. Sometimes you just feel a nice warm sensation, but nothing that's uncomfortable. And then as far as the downtime with this treatment, there is none. There is, you might have a little bit of pressure, a little bit of sensation like you have to go to the bathroom, but that will usually subside within about 24 hours if you get any at all. But you can resume normal activity. You can have sex that very day if you want to. Sometimes I discourage people to doing that just because your tissues are a little bit inflamed, so you might just add a little bit more friction. And if you are somebody who is already complaining of vaginal dryness or pain during intercourse, this might not be the best option for you. And then this next slide will show you, it's a little blurry, so I do apologize. This is the best picture that I could find. But this is the probe for the FemiLift. Again, it is a little bit larger than the Vitalia, but still women tolerate this one pretty well. This treatment is a really quick treatment, actually. It can be done a little bit faster than what the Vitalia can be, just because we're not warming the temperature or the skin in this one. We're actually just pulsing. So this one can be a little bit quicker. So backtracking a little bit, I didn't explain to you guys, as far as these treatments go, they are done in a series. It is really important to stay on a series and to come in. You're going to get 3 treatments. So 3 treatments once a month. So let's just say if you would start today, then you would be looking at February, March, and April. You would do your initial round of treatments. And what we're doing is we're just coming back and we're re-stimulating this collagen in your tissues to help regrowth, and so that you can start to see that regeneration coming. The same story goes for the CO2 or the FemiLift. They both are a 3 treatment once a month. And then after that, you do have to get into a maintenance series. Unfortunately, not everything is permanent. Our body is still going to continue to age. So we encourage you to come back every 6 to 12 months for your first maintenance treatment. If you are somebody who struggles really, really bad with dryness, or you have a significant amount of stress incontinence, you may need to come back a little bit sooner than that. Our body really is the one who tells us when it's time to come back. But it's really up to you and at your discretion of when you come, but I would not let it go past a year. Really, if you want to maintain your results and keep up everything, then staying in that 6 to 12 month range is really the best option for you. So again, if this is something that you're interested in, I offer a complimentary consultation. You can come in and chat with me. We can talk about what's going on with you and how I can help you with that, and excuse me, answer any questions then that you may have about that. So then we will jump into the O shot. The O shot is another piece to our puzzle here. What the O shot is we draw your very own blood and we spin it down, and on the top of it comes off what's called PRP. It's platelet-rich plasma. That is all of our body's goods. It has growth factors, it has stem cells in there. And what we're going to do is we're going to re-inject that concentrated fluid back into the areas that need regeneration. So for the O shot, we inject that into the clitoris, and we inject that into the actual vagina. So I promise before we do all of that, you are nice and numb. We try to keep you as comfortable as we can be. And then we, let's see, sorry, I kind of lost my train of thought there. Keep you nice and comfortable, and then we do those injections. And then after you leave here, you don't really have a lot of restrictions. You're just going to maybe feel a little full or a little tender to touch. But the O shot, again, is going to do those same things that we talked about. It's going to increase your sensation. It's going to improve your vaginal lubrication or your vaginal moisture. It also helps to strengthen that pelvic floor, that muscle there. And then this one, again, is something that is, better done in a series. You're going to get better results. It does take our body time to rejuvenate. So this is not something that you're going to see that immediate reaction or that immediate change from. It's going to take our body a little bit of time. So sometimes you can be at about 3 months before you really start to see, maybe my vaginal moisture is a little bit better, or I'm starting to see a little difference in my stress incontinence. But I love this treatment because it's using our own body to repair itself. So what better things to do that? And our body is so amazing that it, has the capability to do that. This treatment is done by Dr. Ferris. So if this is something you're interested in, he again will offer complimentary consultations to any of you that are listening tonight. You can come in and chat with him about it. I can tell you personally from myself, I did not even feel this happening. I was really nervous about how uncomfortable it was going to be because the thought of it kind of makes me cringe. But it was super comfortable. We put numbing cream on you for a while, let you sit and relax. And then he also uses injectable lidocaine to help keep you nice and comfortable as well. So another great treatment that we have to offer here. Now, a lot of people will ask, okay, you have all of these different things. What should I do? And each and every one of you are so different and so individualized that it just really depends on you and your symptoms of what you have going on. If you're looking for increasing your libido, that really is more sticking with the pellet therapy. That's going to do it. But if you are struggling with dryness and incontinence, then those are more, you're going to get those same, you're not going to really get a change with your incontinence, but you will with the dryness. But if you're looking to increase your sensation and you're looking to help with that urinary incontinence relief, then doing the O shot or the Vitalia or that FemiLift is really the better option for you. So like I said, I really just encourage you guys to come in and chat with me, because then we can customize a plan for you that fits your lifestyle and of course your budget. So with that said, we will kind of jump into probably what you all are wondering. On here is the promotions that we have for the night. For joining in, we are going to offer you some specials. So what's not listed on here is the BioT or the bioidenticals. That is a free consultation. That is where we will start with. So we start with the free consultation. Then you will have a lab draw fee, and that will be $150 for your initial lab panel. But then when you're looking at pellet insertions, remember it's every 3 months. And so it's $350 every 3 months for that. And then jumping into the vaginal treatments. So our Vitalia is a package of 3. So like I said, we have to do those in a series 1 month apart. Tonight, you are going to get a free maintenance treatment. So normally our maintenance treatments are $600. So you do get a nice little savings on that. So think like you're going to get 4 treatments for $2,500. And then as far as the O shot goes, our pricing for that for tonight is going to be $1,000 for that initial one-time treatment. But everything is better in a package. So if you decide that a package is what you want to do, we again would do that 1 month apart. So 3 times. And you're going to get that for $2,250. So another really great savings on that. And that again is just using our own body to heal ourselves. So I hope that you guys have enjoyed this, and that you are interested, and I hope that you will come in and visit with me. I would love to see you all here. So that is kind of my spiel for the evening. So I hope, like I said, you guys enjoyed it, and come see me here at the Med Spa. You guys have a great evening, and we'll see you later. Bye.